Hello my friend. In this video we will talk about a little discussed but very important topic because knowledge about this subject can be extremely valuable in an emergency situation, especially. Let's have a conversation about penile fracture. When we discuss fracture, we immediately think of broken bones. However, the term penile fracture may appear strange because the penis does not contain any bones. However, penile fracture is an extremely serious and genuine medical condition that, although rare, necessitates immediate attention and proper treatment in order to avoid long-term complications. I am Dr. Jose Marcos Neves, obstetrician gynecologist, researcher in preventive medicine with a focus on longevity and also on issues related to the sexual well-being of the couple. This channel was created with the purpose of socializing content related to these topics for free and with the aim of disseminating information to a wider audience. Before discussing the topic of today's video, which is penile fracture, I would like to inform you that we will soon be introducing a new module of our fantastic sexuality course featuring extraordinary and life-changing material. Secure your spot on a unique journey immediately. Click on the link here in the video description, sign up to be notified about the opening of vacancies that will happen in the future. The course is open to a few people so that we can provide a more personalized attention and support to you. In our course on sexuality, we will have discussions on all subjects without any prejudice or bias. Do not miss out on this opportunity we have created to explore new levels of pleasure and intimacy. Book your spot in advance and be among the first to embark on this incredible transformation. Returning to talk about the subject of today's video that we proposed, the anatomy of the penis is complex and incredibly adapted to the functions it performs. The cavernous bodies, two elongated structures that fill with blood, become engorged and rigid. This rigidity is essential for penetration during sexual intercourse. However, if a sudden and severe force is applied to the erect penis, the lining around the cavernous bodies, called the tunica albuginea, can rupture, resulting in a penile fracture. The moment of injury is frequently accompanied by an audible snap, followed by a highly intense pain, swelling, and often bruising, which is a purple or bluish discoloration that occurs as a result of internal bleeding within the affected area of the body. It is a urological emergency that, without proper treatment, can lead to complications such as penile curvature, erectile dysfunction, and pain during sexual intercourse. In this video, we will delve into the intricacies of penile traction. We will address the physiopathology, including how and why it happens, as well as the treatment methods, recovery process, and the potential consequences of not treating this condition adequately. Our objective is to clarify, provide info, and raise awareness about the significance of taking care of the sexual health of the couple. Follow us in this rigorous scientific investigation on a topic that, despite being little talked about, is of utmost importance in the clinical practice of urology. To stay well informed about all aspects of sexual health, make sure to subscribe to the channel, like, and share this video for more valuable information and updates. The accurate information can make a significant impact on caring for your body and also your overall well-being. Penile fracture, despite being a non-technical term, is utilized to describe the rupture of the tunica albuginea, the layer of resilient tissue that surrounds the cavernous bodies of the penis. This medical condition is considered a neurological emergency and requires immediate intervention. Fractures of the pineal gland generally occur during vigorous sexual intercourse, but they can also result from direct trauma or an accident, for example. The clinical diagnosis is characterized by an auditory click, intense pain, hematoma, and often comes immediately after an erection. In some cases, the urethra may also be involved, leading to difficulty urinating or presence of blood within the urinary meatus. The initial step is immobilization and the application of cold compresses in order to minimize edema, swelling, and internal bleeding. The administration of analgesics may be necessary for pain control. Surgery is the gold standard for the treatment of penile fractures. The procedure involves the removal of the hematoma and the repair of either the tunica or the ruptured buccia. The surgical approach depends on the location and also the extent of the damage. In cases where there is suspicion of urethral injury, additional procedures may be necessary to repair the urethral canal. The post-operative follow-up comprises of rest, abstaining from sexual activity, and monitoring for the healing of the wound. The duration of the abstinence period will vary, but it generally lasts for approximately 4 to 6 weeks. Throughout the recovery phase, it is crucial to adhere strictly to the medical guidelines to prevent potential complications in the future. If proper treatment is not done, penile fracture can result in deformity of the penis, chronic pain, erectile dysfunction, and psychological problems associated with sexual trauma. Penile fracture is a condition that, although not common, necessitates recognition and immediate treatment. Surgery provides exceptional functional and aesthetic outcomes when performed in a timely manner. You can't waste time. It is essential that education about sexual health includes information on how to prevent injuries and the importance of seeking prompt medical care in the face of any sign of penile trauma. The sexual well-being of the couple is crucial for their overall health, and access to accurate information is essential for preventing and treating any challenges, including this one. If you discovered value in this content, do not keep this treasure solely for yourself. Subscribe to our channel for additional knowledge that can be a genuine beacon in the night of doubts and uncertainty. Please leave your like, as it directs us and guides us in the right direction, enabling us to always bring more and more content to you. Please don't forget to share and activate the bell icon in order to be notified about the upcoming videos that are already being produced and will be released soon. Comment on what you thought of this video. Your opinion is extremely relevant to us. When you have interaction on our channel, the algorithm understands that our content is serious, it is important. So don't stop helping us, because it is very relevant. Now I'm going to say goodbye, take care, a big kiss, and see you in the next video. Thanks.